Nashville. You're up early and listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason on News Radio 1510 WLAC. I'm Dr. Liz Baker.
And I'm Dr. Jason Reinhardt.
We're your local health and wellness experts. We are both successful chiropractors running busy family practices. My office is down in Brentwood, Tennessee.
And I'm in Franklin, Tennessee, and we have a combined total of 23 years experience in practice. Man, I can't believe it's been in that long.
I know. Don't forget those last 3 years.
Yeah, 23 that is. So.
All right. So we've got some interesting information to go over today, an interesting topic to cover.
All right.
We're going to go over some different health topics on this show, and today's topic, this one in particular, actually affects 80% of the population.
I have many patients coming in every week that this is what brings them in.
Absolutely.
It's the majority is women.
Yes, the majority of these people are also women, and the U.S. spends over $17 billion a year trying to treat this particular problem.
The World Health Organization says that 1 in 20 adults has this problem nearly every day.
If not every day, almost every day. Or if not almost every day, every single day. And sometimes people have multiple of these in the same day, which is interesting. And this is the most common disorder of the neurological system.
And those that are affected, it can start in the teenage years, and it sometimes continues lifelong.
And that's debilitating for some of these people as well. In recent decades, this is starting to be affecting more and more children than we have ever seen before.
Yep, and there's 4 major types of this condition.
The 4 major types, according to the World Health Organization, with the most common type actually being caused by the very medication that is used to treat it. Can you believe that?
No, that blows me away. And also, according to the World Health Organization, a lack of knowledge among healthcare providers is the principal clinical barrier.
That's amazing as well, just the lack of knowledge. And the reason for that is worldwide average at the undergraduate medical education level, the doctors only get 4 hours of coverage on this particular topic dedicated to this very common disorder.
Blows me away that the U.S. spends $17 billion a year on this, and the average doctor gets under 4 hours.
I know, you think they'd put a little more time and effort into this one.
You would think.
Do you know what we're talking about yet?
I'm guessing, and the big reveal is headaches.
Headaches. Something as simple as headaches and migraines, these fall into the same category. Something that simple is causing a $17 billion a year industry, and we're not getting enough information out there about it.
Yep, and it's headaches, and maybe you or a loved one suffers with chronic headaches or migraines, and they're horrible. They're debilitating, and we're here to tell you that they are very common, but they're absolutely not normal.
They're absolutely not normal. There's no such thing as a normal headache, and we'll get into that in a little while, but headaches can be draining. They can be life-sucking. They can affect your everyday life, especially if you're one of those people who are having daily or even multiple daily headaches.
And I can't tell you how many moms, dads come in, and I give them credit because I can't imagine, I'm a father myself, and dealing with children, trying to go to work, just trying to run your day when you have constant headaches. It's a horrible thing, and it's a way you do not have to live.
Absolutely. I couldn't imagine going to work every day with a headache. I deal with other people, and they're complaining to me about their pain. And if I was in my office and trying to suffer through my own headache while listening to somebody else complain about theirs, I can only imagine I would be a bleep word right then.
Yeah, the closest I get to that is I have, unfortunately, some people in my life that cause me headaches, but not the physical kind that we're talking about in your body right now.
Absolutely. So headaches can be very affecting on people's lives. They can affect your job. If you're missing work because you have headaches, eventually your boss is going to get pretty mad at you about that, and that could be having some consequences there. But it can affect your family or your time at home with your family and your kids, and even just your life in general. I have a patient who has had to cancel a trip to Europe because she was having such debilitating headaches. She was terrified to get across the pond there and be stuck with headaches and not have anything to help her.
Yeah, and that would be terrifying. I mean, what a way to ruin vacation, huh?
I know. So you're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason with News Radio 1510 on WLAC. And as always, we're your local health and wellness experts. I'm Dr. Elizabeth Baker.
And I'm Dr. Jason Reinhardt.
And for more information about this show, healthy tips, and DIY recipes, follow us on Facebook at Guide to Healthy Living Radio, or check us out on the web at aguidetohealthylivingradio.com.
Exactly. And we're talking about headaches right now. And what Dr. Liz and I are all about are getting people back to their lives. You know, people come in and see us in the office for a variety of reasons, but it's about getting their life back. And when you have headaches, your life is fading away. It's a horrible way to live, and we're here to tell you you're not placed on this earth to live in pain every day.
Absolutely. When we were talking earlier, if you just tuned in, you missed that we said the U.S. spends $17 billion a year trying to treat headaches, and that is an exponential number that's growing, and it's now starting to affect more children than ever before either.
Yeah, it's unbelievable the amount of kids that I have coming in because they're having headaches every day.
It's not something I ever really realized was happening until I as well started seeing kids for headaches. Right now, I currently have at least half a dozen kids that are coming in for active care for headaches right now this week.
I mean, it's amazing. You know, it's not the parents' fault. It's not anybody's fault. But I hear this all the time. You know, we only have headaches a few times a week, but that's normal. It is absolutely not normal. I'm here to tell you that a headache is not normal at all.
No headache is normal. There might be common headaches where you're commonly getting them or frequently getting them, but that does not mean it falls under the normal category.
Yeah. And you know, and we're talking with you out there, if you are one of these people, you know, experiencing headaches, if you're someone that's had to miss work because of headaches, skip out on events, cancel plans.
Cancel trips.
You know, and it's just, you know, one of those things where you got a fun date planned with your spouse, but, you know, you got a headache and you don't want to do it.
Or maybe it's not your spouse. Maybe it's a first date with somebody you've been trying to get a date with for forever, and now you're not able to go because you just feel like crap.
Or maybe you're the parent driving home and you know you got those little kids waiting for you and they're all excited to see you. And you just know that, man, you're just not going to be able to deal with it because of the headache.
And I know some people out there get real snappy and irritable because your head is just always hurting. You just can't relax. You can't enjoy your day. You can't enjoy what you're doing. And these are extremely common. And these are one of the things I actually see the most of in my clinic.
And we want to help these people, Dr. Liz. So can you tell them what we're talking about here?
Yep. So a little bit later, we're about to cut for a commercial break. We're actually going to go over what are the most effective and drug-free treatments for headaches. When we get back, we'll go over that, and we will also have a special offer for our 21st callers that call in. And if you want an appointment with Dr. Jason or myself, we'll do a consultation and exam and a special type of x-ray that we'll go over shortly. And we'll tell you what that special is when we get back.
You're listening to A Guide to Healthy Living with Dr. Liz, and I'm Dr. Jason Reinhardt on News Radio 1510 WLAC. As always, we are your local health and wellness experts. And today we are talking about headaches. Before we went to break there, Dr. Liz was talking about a special offer we're having for everyone out there that is experiencing headaches. So, Dr. Liz, what are we offering?
Sure. I was mentioning right before we went to break that headaches and migraines are probably one of the most common things that people come to me in my office for, as well as you. And what we were offering was for the first 20 callers, and that's the first 20, we're offering an appointment with Dr. Jason or myself for a consultation, exam, and a special type of x-ray that we'll go over in a moment that only about 700 doctors in the world know how to do. Normally, this test runs about $250, but for today, only for the first 20 callers, and mention this show when you call, this offer will not include Medicare or workers' comp, but today that test is only $20.
Absolutely, and it's one of these things where I can't encourage you enough to give us a call, and you can always reach us at 615-727-3107. If you are a person that is suffering with headaches, if it's affecting your life, it's time to stop because there is an alternative. You know, I have, and I don't know in your office too, Dr. Liz, I have so many people coming in that all they know to do with headaches is because they've been to their medical doctor is take a form of medication.
That's pretty much the common go-to, whether it's over-the-counter medication or some kind of prescription strength, which is typically what ends up happening. But you out there, if you're listening to this show and you've had more than one headache within a month, that's a very likely chance that you've got an underlying health problem, and the time is now to get that checked out. Stop suffering and stop letting your headaches dictate your life.
Well, the time is now to listen to your body. Headaches, pain, they are there for a reason. It's your body's signal to you saying that something is not right. Now, you have two choices of the way to do it. You can simply address the symptom, take something and cover it up and pretend like you're okay, or you can do what we would recommend, and that's look at the underlying cause. The underlying cause is what we're about correcting so that this problem goes away so that you don't have to live with it anymore.
Absolutely. And I mentioned a minute ago those special type of x-rays that we take. We take a special type of x-ray called a motion study x-ray. And like I said, only about 700 doctors in the world have been trained in this special type of motion study. But what it shows us is actually what's working and what's not working in your body. It clearly tells us where we need to address our efforts as well as getting things corrected so that you can stop suffering with your neck pain, your headaches, or whatever other ailment we're trying to address.
Yeah, we're very precise in what we do, and it is an amazing tool so that we can actually take a look at your cervical spine, that's your neck, and we can get in there and we can see how each one of those individual vertebrae is moving or not moving, or is there abnormal movement going on. And it's also something that we love to show our patients because we want to educate you. Knowledge is power, and if you understand what's going on, then you can take the steps to correct it.
Yeah, and a little bit later, we're going to go over, again, what's the most effective drug-free treatment for headaches. But first, I just wanted to touch on that Dr. Jason just brought up something about the neck. We're going to look at the neck for headaches. Why is that? That may not make sense to you right away, but most headaches have something called a cervicogenic link, meaning they come from your neck. So it may hurt in your head, but the problem's actually originating from your neck.
And you know what? It's very interesting. This is something that you can do listening right now, and you've probably already done it. So many of my headache sufferers, when they come in and we're sitting down and we're going over what's going on, they point right at the base of their skull, and they say, right here, when I push right here, this is where it hurts. This is where the headache's coming from. And if you're one of those people, just feel at the base of your skull right now. And if it's sore or tender in there, very good chance you have exactly what we're talking about. And Dr. Liz, I just wanted to point out our lines they're actually lighting up. So we are down to, it looks like we have 16 of those spots left. And
16 spots left?
Can you go over what that is again and what
Sure.
we're offering?
Sure. So we said for the first 20 callers, we're offering an appointment with Dr. Jason or myself for a consultation, exam, and that special x-ray we just went over. Normally that test is $250, but today for the first 20 callers, and although we only have 16 spots left, mention this show, and today that test is only $20. Again, this does not include Medicare or workers' comp.
Yeah, and you can reach us and take advantage of this offer by calling us at 615-727-3107.
And if you're just tuning in, you're wondering who the heck we are, you're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason on News Radio 1510 WLAC. We're your local health and wellness experts, and I'm Dr. Elizabeth Baker.
And I'm Dr. Jason Reinertz, and you can also follow us on Facebook. It's Guide to Healthy Living Radio, or check us out on the web, aguidetohealthylivingradio.com.
There you go. It's a tongue twister when you got to say it
goodness,
twice.
I'm getting all tied up.
But what we're just going over is headaches and how people suffer with headaches and they think that it's normal. And then we are also discussing how most of those headaches actually come from a neck problem. Now, this can actually happen with or without neck pain. So neck pain is actually something we're going to go over a little bit later in the next segment, but a lot of these people with these cervicogenic headaches have the neck pain with those headaches, and that's actually affecting 76.5 million Americans, and that's just in America. That doesn't count the whole world.
It's amazing. As I was researching our show, it is amazing that more Americans live with pain than diabetes, cancer, and heart disease combined.
That's right.
It is amazing, and it breaks my heart, the number of people that aren't living to their full potential. They are living in pain every day. And what's sad is I see patients like this all the time, and I'm sure you do too, Dr. Liz, where I ask them, I simply say, how have you been living like this? And they say, the amazing thing is I've learned to live with the pain.
I deal with it. I've just learned to deal with it, or I push through it. I don't know how often I hear that.
And I'm like, what a horrible thing to learn to live with. I learned to live with the pain. I hate hearing that. And then one of the best things in my office is when you see that person getting their life back, and then they tell me, they go, I can't believe I lived for this many years that way.
Absolutely. And that brings me to a good example. I have a patient, and she's 9 years old now. She's 9 years old now. And I first started seeing her almost 4.5 years ago. And at this point, her mother and her father had already expended all of their other options. Their 4-year-old was having debilitating migraines multiple times a month. On top of that, she was having what they were calling her little headaches, ones that weren't as bad, ones that weren't making her vomit and that sort of thing. But they were expending all other options. They had taken her to every neurologist in town at Vanderbilt, and they were about to put her on anti-seizure medication. And if you know anything about that, that's some pretty strong medications. She wasn't even having seizures, but they didn't know what else to do for her. After just a month under care in my office, she's been off all medications. She's had almost zero headaches. I think in the last 4 years, we can remember her having maybe 4, what she called little headaches, but she's not had any more migraines. And we've gotten her back to her being a kid again. Her mom came in tears one day, and I thought, oh no, they've had another headache. We've had a setback. It wasn't that at all. She came in and said, Abby played on the playground today.
It's awesome.
And I didn't realize that was a thing with her, but she said her teacher said for the last 2 years, she sits with the teachers at recess. And this was the first day she actually went out and played with the other kids because she just felt like it. And her mom was in tears of joy.
That is so awesome.
She got her little girl back.
And that's what it's all about. It's about getting your life back because, you know, the reality is most people that come into my office, I'm sure you're the same way, Dr. Liz, it's not the headache that's bringing them. It is, but it isn't. It's what it represents. It's not being the spouse you want. It's not being the father you want. It's not being able to perform at your job. So, we're about down to 13 spots left. Can you go over again what we're offering, Dr. Liz?
Sure. We've got 13 spots left. We were offering for the first 20 callers, so now for the next 13 callers, we're offering an appointment with either Dr. Jason or myself for a consultation, exam, and that special set of x-rays that only 700 doctors in the world know how to do. Normally that test runs $250, but today, for the next 13 callers that mention this show, it's only $20. This offer does not include Medicare or workers' comp.
And to take advantage of this offer, give us a call at 615-727-3107.
Absolutely. So in the next segment, we're going to talk a little bit more about neck pain and how that can relate to the headaches and just neck pain in general. When we get back, we'll go over a little more about how we actually treat headaches and neck pain in our office. You are listening to A Guide to Healthy Living Radio with Dr. Liz and Dr. Jason on News Radio 1510 WLAC. We're your local health and wellness experts. I'm Dr. Elizabeth Baker.
I'm Dr. Jason Reinhardt, and we're here to tell you you do not have to live with headaches.
You do not have to live in pain. You do not have to live with headaches. And for more information about our show, for healthy tips, DIY recipes, and more, follow us on Facebook at Guide to Healthy Living Radio or a guide to healthylivingradio.com.
We'll be back. Good morning. You're listening to A Guide to Healthy Living with Dr. Liz, and I'm Dr. Jason Reinhardt. It's on News Radio 1510 WLAC. As always, we are your local health and wellness experts, and today we are talking about headaches.
And I'm Dr. Elizabeth Baker, and for more information about our show, you can always check us out online on Facebook at Guide to Healthy Living Radio or on the web at aguidetohealthylivingradio.com. We're just talking about our special that we were offering, and we'll get into that in a second again in case you missed that. But like Dr. Jason said, we were talking about headaches, neck pain, and I gave a little testimonial for a patient I actually had in my office who was having headaches as a child. Do you have anybody from your office that you can think of that stands out for headaches?
Yeah, you know, I definitely do. I have many people that come to mind. This is why it's such a personal and passionate topic for me, because a lot of the times what we deal with in the office is someone comes in for a headache, but you really don't get the whole story. Like we've said before, it's not the headache that usually brings people in. It's what the headache is representing that's taking away from their life. And for me, I'm thinking of one particular gentleman that came in and, you know, he had headaches and he downplayed it and said, no, they're not that bad. Come to find out later, his wife shows up with him one day in the office, and my front desk says his wife wants to meet with you. I'm thinking, oh my goodness, what is this all about?
What have I done is usually what I think.
Yeah, I'm like, okay. So they put her to wait for me back in a room. I go back in there. She walks towards me and just hugs me. And tears start flowing.
Aww.
And she says, I can't thank you enough. And I'm going, okay. I go, I'm not quite sure what this for. And she goes, you know, I know my husband probably didn't tell you this, but we were on the verge of a divorce.
Oh.
And she says, you saved our marriage. Now, I'm not going to take credit for that, but she said basically, and I'm going to abbreviate, that he was a cranky SOB all the time, and it was destroying them.
Sure.
And she said now he is back to the person that she married.
Oh, that's awesome.
And those are the things that float my boat. Those are the things that, I'm sure this is true for you, Dr. Liz, makes me jump out of bed in the morning, and I can't wait to get in there and show people that there's a different way. There's a better way, that your bodies have the ability to heal from the inside out, that you don't need a foreign substance, a drug, or something from the outside. Now, there are occasions where you do, and I'm not going to say that, everyone falls into this, but for the majority of people, you just need to know. You need the vessel. You need the information to say, hey, and it's empowering to say, I'm taking back control of my health and my life, and I'm going to get over these headaches. And so for everyone who's listening that wants to take advantage of this and that wants to get their life back and get rid of these headaches, Dr. Liz, what are we offering?
Sure. Like we were saying, that this is extremely common, and we deal with this in our office all the time, and it's probably the most common thing that I see. But we're offering for how many callers we got left?
Let's just call it at 10. We're a little below that, but I still want to offer 10 spots.
All right. I think we only got 9, but we'll make it 10.
Yeah.
For the next 10 callers, we're running out of spots. We're offering an appointment with Dr. Jason or myself for a consultation, exam, and those special motion study x-rays that only 700 doctors in the world are trained to do. Normally, this test runs $250, but today, for the next 10 callers, we will, if you mention this show, we'll give you that same offer for only $20. The offer does not include Medicare or workers' comp, unfortunately. But if you want to take advantage of that offer, give us a call at 615-727-3107.
And I really want to dive in again that what makes us so successful is the training that we've put in so that we can figure out exactly what is going on in your cervical spine. That's your neck. And it's these motion studies that we do. And they're a way that we can get in there and we can specifically see how each one of your cervical vertebrae, there's 7 of them, how are they moving? Are they moving correctly? Are they moving abnormally? We can take a look at that. And you know what the really cool thing about this is we are about correcting the problem, not just patching it. And when we get you to a certain point, we X-ray you and put you through the same motion study so that we can show you the correction.
We can show you what we've fixed. We can show you we've fixed not only your symptoms, but we can show you that we fix biomechanically the stuff that was malfunctioning before and show you that we've actually fixed it. Now, I don't know why everyone doesn't do this, because it's really the only black and white way to see what we've fixed. There's only one way to see that, and that's by re-X-raying at the end and doing the test over and making sure you pass it the second time.
Yeah, because we want to show you not only now are you feeling good, but you're working good. You actually are better. You're corrected. You're not just patched. It's not something that's going to come back, next week or, a month later. It's something that we've actually corrected the problem.
Absolutely. And that's something we do hear a lot is, when I take Excedrin or when I take my Topamax, whatever it is that they're taking, sure, it fixes the headache at that moment, but does it come back the next day? Does it come back the next week? Possibly. Very likely.
Yeah. And, the other thing that we really dive into, too, is we want to explore your life. We want to know what you're doing so that we can correct those bad behaviors so that you don't need to come in and see us all the time.
Absolutely. That's one of the things I like to focus on in my office. I actually offer a workshop for this because you're only in my office maybe 20 minutes each appointment, and there's 23 hours a day for you to go outside of my office and screw it up. So I like to make sure everybody knows what not to do as well so that they get the most out of their care. I really care about my patients, and I want them to get better.
Absolutely you do. And you're listening to A Guide to Healthy Living with Dr. Liz, and I'm Dr. Jason Reinhardt on News Radio 1510 WLAC.
All right, and as always, we're your local health and wellness experts. And if you want to check us out on the web, go to aguidetohealthylivingradio.com or follow us on Facebook. We're going to start posting a lot more DIY recipes and healthy tips on there. Find us on Facebook at Guide to Healthy Living Radio.
And being wellness corrective chiropractors, it's something that I love that title. I stand behind it because I'm all about tapping into your body's potential, clearing out interference that your body can heal from the inside out. So you don't have to be someone that's, I have patients. It's amazing to me that they show me. I said, well, what do you do for your headaches? And they pull out a huge bottle of Excedrin. or even sometimes stronger medications, and they say, this is what I live on. And you know what terrifies me is I know the side effects of this drug. I know what long-term use of this drug is going to do to me, but I don't have any other thing to do.
They don't know what else to do.
And they said, I'm stuck. It's either I take this or I don't function.
And the flip side of that, some people have already tried, say, the Excedrin or the other over-the-counter drugs, and those aren't working anymore. So now what do is they get something stronger. They get a prescription strength medication, and it knocks them out. They take it, and they can't function. They can't drive a car, but at least they don't have a headache. But they might feel, a lot of times they tell me they feel drunk, or they can't move, they can't walk, they can't do anything when they take that stuff.
And what even scares me worse than that, if you can imagine, I do have some patients that say, what are you doing? They're saying, I'm waiting till the bones degenerate enough in my neck that I am a candidate for surgery.
That doesn't make any sense to me.
I'm like, oh my goodness. So you're actually hoping your body breaks down further so then your insurance will pay for you to go get a surgery.
Which spinal surgery does not have a good track record.
No, it absolutely doesn't. So if you are somebody that wants your life back, you're somebody that, you just know you dread waking up in the morning because the headache's going to be there. You dread coming home at night, working that long day because you know that headache's going to be there. We're talking to you. We want to help you. We're experts at doing this. It looks like, 5 spots left?
We'll say 6.
6? Okay. And what are those spots for? What are people calling for, Dr. Liz?
People, if you are calling, you're calling for the offer that we offered earlier, and that is we're offering an appointment with Dr. Jason or myself for a consultation, exam, and those special motion study x-rays. And as I mentioned before, there's only 700 doctors in the world that know how to do these x-rays. And normally that test is $250. But today, for the next 6 callers, if you mention this show, it's only $20. And this offer does not include Medicare or workers' comp, unfortunately. But if you are interested, give us a call, 615-727-3107.
And then they always, that's where you want to call for the offer. But to find out more information on our show, you can always look at us on Facebook. That's Guide to Healthy Living Radio. Or you can check us out on the web, aguidetohealthylivingradio.com. And once again, I'm Dr. Jason Reinhardt. I got a private practice in Franklin, Tennessee.
And I'm Dr. Elizabeth Baker, and my office is in Brentwood, Tennessee as well. Both of us focus on running busy family practices. We actually both had to jet out of our busy office today just to get over here in time to make it for the show. And then we have to run right back. So
yeah, and we got to combine, now I'm going to say this right, 23 years of experience dealing with problems that we're talking about, specifically headaches. So if we're talking to you, give us a call. Again, what's that number?
615-727-3107. And you're listening to A Guide to Healthy Living Radio with Dr. Liz and Dr. Jason. And when we get back in just a second, or just a minute, I guess, from the commercial break, we're going to go over a little bit more about how those headaches can be tied into your neck.
Good morning. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason, News Radio 1510 WLAC. As always, we are your local health and wellness experts.
I'm Dr. Elizabeth Baker.
And I'm Dr. Jason Reinhardt. Dr. Liz has private practice in beautiful Brentwood, Tennessee. I'm located in Franklin, Tennessee. And today we are talking about headaches.
We're talking about your headaches.
Definitely. We're talking about your headaches and what they represent that it's taking away from your life, not being the person that you want to be, the spouse, the father, the mother, the coworker.
Not getting your job done, not getting your life back. A lot of these things affect people in different ways depending on what's aggravated and when it's aggravated. But we were also mentioning how headaches can be tied in with a neck problem, and often headaches are caused by a neck problem. And it doesn't mean your neck has to hurt, but sometimes it will. But what about those people that have headaches without that have neck pain without headaches?
Yeah, there's people that obviously have headaches, neck pain together. But there's some people that I'm sure they're out there right now and say, well, I don't have headaches, but man, you're talking to me when you say neck pain.
Absolutely. So at some point, 70% of people are going to have neck pain in their life.
You know what, Dr. Liz, can you We're saying things here. Can you say that number again for people to give us a call? I just got a text on my phone saying, what was that number again?
It's 615-727-3107. And that number is in case you want to check out an appointment with Dr. Jason or myself for a consultation, exam, and those special motion study x-rays that we mentioned before. That test is normally $250, but today for the next 4 callers, it's only $20. And this offer does not include Medicare or workers' comp. And that number again, 615-727-3107.
And if you're someone who has been suffering with neck pain, headaches, what we're going to do with that offer is you are going to meet with either Dr. Liz or myself. We are going to sit down with you. We are going to go over a complete history. We're going to examine you, and we're going to take these special x-rays where we're actually going to put you through a range of motion so we can see exactly how those bones in your neck are moving or are not moving. And then we're going to go over all this with you because knowledge is power. We're not going to sit there and say, this is what's going on. We're going to show you. So again, if you are someone that is suffering with headaches or neck pain, what is that number again to call?
615. Sorry, I got it written down here. 615-727-3107.
And again, I'm not even going to say how many spots we have left. Just give us a call if this is you. We want to help you. Normally this runs $250, but what we're doing today for the first 20 callers, and we just went over that number, but what we're doing is we're offering it for $20. So talk about a small investment to get your life back. Again, that number is 615-727-3107.
All right. Now that you've heard that again, like I was saying a second ago, 70% of people will have neck pain at some point in their lives, and most people will visit a conventional physician for that. And there's a very good chance that you'll leave with some sort of prescription medication or some sort of recommendation for an over-the-counter medication. Some people don't want to take medications, maybe against their religion. Maybe they're trying to get healthier. Maybe they're afraid to take medications, which
Absolutely.
I do hear a lot, actually. People are afraid to take medications because they're afraid they're going to get addicted to that medication.
Yeah, it's a huge problem in Tennessee right now.
Absolutely. There's a huge opioid epidemic, and I can't blame people for that. But there's also something interesting. If we go back to the headaches, one of the more common types of headaches is actually caused by headache medication. They have a headache, they take the medication, the headache goes away, but then they almost go through something similar to like a withdrawal, and it gives them a headache again. So what do? Is they take the medication again because that's what makes it go away, and it's a vicious cycle. I actually had a family member go through this for 25 years, ended up going to Mayo Clinic, and that's what they decided was he was having headaches originally from a structural problem, but then was taking the over-counter stuff and then started having those headaches that were caused by the medication he was actually taking.
Yeah, it's unbelievable.
It's a terrible cycle. And those are pretty common as well. And most people will start taking that for a structural problem, and it turns into a bigger problem once they get that medication in their system.
And the challenge is if you are someone out there who is routinely what we call popping pills, you know that it's not effective and it's not working because what happens when you stop taking your medicine? The headache is right back.
Absolutely. Now, there's a time and a place for that. So if you're looking to discontinue your medication, always speak with the physician that prescribed it. But
Absolutely.
If you are interested in getting off of those medications, that's who you need to speak to as well. But you also should find a different option for your pain and for your headaches.
Your bodies, they want to be healthy, but right now you're exhibiting health as the best you can. And unfortunately, that looks like miserable pain, not living up to your potential and not being the person that you want to be because you have headaches on a regular basis or neck pain.
Absolutely.
And we're here to tell you that it's a lie that you have to live like that. So if you've been told this, no.
So there was actually, that's interesting you say that. There's a recent study by the American Osteopathic Association that 1 in 2 Americans say pain is a part of their life, including neck pain, low back pain, headaches, some sort of chronic pain. And another 41%, they actually believe pain is just a standard part of the aging process. And I'm here to tell you, pain does not discriminate. It might be something that's common, but doesn't necessarily have to be normal. I've got people that are in their 70s that are training for half marathons, 5Ks, and they have spines that look better than mine, and I'm, 40, 50 years younger than them.
Yeah, absolutely. Headaches, neck pain, and just pain in general, just like Dr. Liz says, does not discriminate. I have patients that are extremely young. I'm talking grade school that have come to me with headaches, and I have people of all ages all the way up to the person in the nursing home that says, I have headaches. They're affecting the whole population.
Absolutely. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason on News Radio 1510. We're your local health and wellness experts. I'm Dr. Elizabeth Baker.
And I'm Dr. Jason Reinhardt.
And for more information on our show, for healthy tips and DIY recipes, go to Facebook at Guide to Healthy Living Radio, or check us out online at guidetohealthylivingradio.com. And if you're just tuning in and listening, we are actually offering a special for the next 4 callers. There's not many spots left.
Can we make it 5?
Sure.
All right, I'm a giver.
For the next 5 callers, we're offering an appointment with Dr. Jason or myself for a consultation, exam, and those special motion study x-rays. And if you didn't hear about those earlier, only 700 doctors in the world have been trained in these type of x-rays. This shows us what's working and what's not working so we can get to the root cause of your problem. Normally that special test is $250, but if you call 615-727-3107 today, that test is only $20. This offer does not include Medicare or workers' comp, but again, that number is 615-727-3107. And I was just talking about how pain and how headaches are not discriminate. They don't age discriminate. They don't sex discriminate. Pain doesn't care if you're a guy or a girl. It doesn't care if you're 6 or if you're 60. About 65% of Americans ages 18 to 35 have said that they've experienced some sort of chronic pain or headaches, either themselves or that they know somebody that they've cared for that has experienced that sort of pain in the last year alone.
Well, and no one likes dealing with pain, but let's put pain into the category of what it really is. It's your body's way to communicate to you to say, hey, wake up. There is a problem. This problem needs to be corrected. And unfortunately, if all you're doing is self-medicating and dumbing down what your body is trying to tell you, you're never going to fix the problem. And just like I wish I could say something different, in my life anyways, it works this way. Every problem that I avoid and just hope it's going to get better, what happens?
It gets worse.
It gets worse. And you know this. Why haven't your headaches gone away? I have patient after patient that sits down and I said, in the last however long, is the problem getting better, staying the same, or getting worse? It's always getting worse. That's what finally drove them in.
Absolutely. Sometimes you'll get somebody that said it stayed the same, but maybe they're staying the same is they're constantly having them every single day for the last 20 years. That's no life.
Or I've just learned to live with debilitating pain. I've learned to live with headaches. What a horrible thing to learn to live with.
Absolutely. Some of you may be wondering what causes this sort of thing, what causes headaches. And as we mentioned before, neck pain or headaches can come from a neck problem, even if that problem coming from the neck has pain or not. And a lot of people do have the associated neck pain, and sometimes patients will tell me, hey, when my headaches start, it starts at the top of my neck and it works its way up and around my head. Maybe it gets all the way behind my eyes, but a lot of times they tell me it starts in the back of their head or at the top of their neck. And you may not associate the top of your neck with your head, but those things are very close together, and there's a lot of neurological stuff that happens in there that, if that's not working properly, can definitely trigger headaches, neck pains, or even upper back pain.
Well, and that's a good point. And I want to make sure that everyone listening understands, if you have any type of pain, this offer's for you too. Give us a call. We don't want you living like this. We're not just taking headache people. If you're saying, you know what, I got low back pain, or I got mid back pain, or I just have neck pain, give us a call too. You don't have to live with any of it, because I'm not going to say a headache is worse than horrible low back pain. It's all horrible, and it's all things that you don't have to live with.
And that number was 727-3107. 615-727-3107.
Absolutely.
So where should we go next, Dr. Jason?
So we've talked about headaches. We've talked about people that have neck pain and headaches. And now we just touched on people that might not have a headache but might have neck pain. But
Absolutely.
All of those serve the same purposes, that your body is screaming out to you saying you have a problem. Let's get it fixed.
Absolutely. And if you're one of the 1/3 of all Americans who, if they actually confessed that they may not talk to their medical professional about their headaches and neck pain or other chronic pain because they know that they're not going to take that doctor recommended pain medication for fear of becoming addicted to that.
Absolutely. I mean, your life's already bad enough, and now on top of that, you have a fear of getting addicted.
Absolutely. And just down the road from my office is actually an addictions call center, and we have a lot of people that work in that call center that say, You would be surprised how many white-collar, blue-collar people, your everyday neighbor, started with some sort of chronic pain, started taking medication for that, and began to get addicted to it.
Absolutely. So once again, give us a call, 615-727-3107, so that you can take advantage of our offer. And you do not have to live with headaches. Something very common, but absolutely not normal.
And exactly, for the next couple callers, for the next about 30 seconds, that offer again is for a special exam, motion study x-rays with Dr. Jason or myself, 615-727-3107. We'll see you next week.
See you next week.